Welcome to DBC Diaries episode 61. Today we are with returning patient David. David was here earlier in the year treating his kidneys. He's had some kidney issues over the years, kidney failure going on, always a tough thing to deal with. We did the mesenchymal stem cells for that, and he saw a lot of improvement, which he'll explain in this video. But this time coming back, we want to take a step further. Now, kidneys can get tough because when you do an IV, it goes first to your heart, then to your lungs. So really good for those organs as it hits them first and in full impact with something like a 300 million IV. But the lungs act like a filter. Up to 70% of the cells can get stuck there for 2 to 3 hours, and a lot of them will dissipate into the lungs if there's any damage. And as you'll see in the testimonial here, David explains it really helped him in his lungs, which he wasn't expecting, really improved his cardiovascular performance, which we've seen with a lot of other patients. And then it got down to his kidneys, but you don't get the full 300 million there. So even though it's very effective, further stages of kidney failure or different kidney issues, it does get more difficult. So he saw a lot of improvement, not 100%, unfortunately. So he's back. And this time we're trying something different. We now offer what are called MUSE cells. These are multi-lineage stress-induced stem cells. And what that means basically is that they're found within mesenchymal stem cells, but we have to stress the culture of the mesenchymal stem cells or the cultured cells until they die. And when they die, the MUSE cells can endure that. We do it's a vibration table, plus we lower the oxygen level until those cells die off and the MUSE cells are left, and then we can start replicating those. And these are true pluripotent stem cells. So mesenchymal stem cells, they work via the paracrine effect. They'll find the damage, they'll go there, they'll guide traffic like they're the manager guiding everything, which is very effective. The MUSE cells, a bit different though, they go and they act like a macrophage. And what a macrophage does is it's one of your cleanup crew. It goes to damaged cells, it consumes them. You'll actually see it envelop the damaged cell or dead cell. And in this case, instead of just removing it like a macrophage would do, which is part of your immune system, it then differentiates into that cell type. So the hope in this case and in this study that we're doing, those are going to get to David's kidneys and they're going to envelop any dead or damaged cells and then turn into new kidney cells. So real regeneration, exactly what you would expect a stem cell to do. So really cool. He doesn't talk about it in this video because we just spoke yesterday and this video is being done about a week after his treatment. But he said that the day after treatment, or even I think it was that night, he went out for dinner, ate a big steak, and he said he could just feel it like in his back behind the rib cage where the kidneys are. He could just feel like this kind of heat and pressure, and a little bit painful, he said, not bad, but he could tell something was going on. So that's really good for us, a good indicator. Obviously, we're gonna have to wait. Fortunately, MUSE cells work faster than mesenchymal stem cells. So within about 3 months, we should have data based on new blood work on how he's doing. And that's part of the study. We did blood work before treatment, and then we require patients that participate in this to do new blood work 3 to 6 months after, primarily looking for GFR scores so we can see how kidney function is. So we're really excited about this, but it is experimental. Just know if you want to be a guinea pig in it, you can, but you know, this is new. It's not tried and true like the mesenchymal stem cells, but as you can see in this, mesenchymal stem cells are awesome yet limited. They don't always get you all the way. So we're trying something new. Brought in Dr. Desawa from Japan to lead this. She's the lady that discovered them. You can go to www.dbcmusecells.com. You'll find everything there, videos, interviews with Dr. Desawa, explaining the MUSE cells and everything else. So stay tuned. You're going to hear David talk about his experience with the MSCs and now with MUSE cells. DBC Diaries Day 1. Today is arrive and rest. David knows where to go. He's been here before, so he's going to meet the driver right outside the airport. They're going to take him to his hotel. He came with his friend Glenn, also a past patient, also filmed one of these. And they go there and they're going to rest, relax, have a good time before they have to get ready for treatment.
right on time, I'll be arriving at David's hotel to take him to our clinic. And when we are done, I'll bring him back.
DBC Diaries Day 2. Today, we start with blood work. With these treatments, it's real simple with MUSE Cells. We just do blood work, check, make sure everything's good. Specifically for David, we want to see kidney function, so we're going to be checking that. We're checking all kinds of other markers, making sure he's good, and we've got lots of data points to check in like 3 to 6 months. About 3 months is expected time range for the MUSE Cells to kick in, so we'll do all the blood work today, and then we'll take care of payment, and then we'll take them back to their hotel so they can go enjoy the beach or whatever fun activities they want to do here in tropical Puerto Vallarta. Today's treatment day. So David and Glenn are going to come in. They're going to go sit with the doc, go over blood work, understand everything, see where they're at. It was great to see improvement on renal function, but we're hoping to get it all the way this time. So we're going to do the MUSE Cells. These are very simple. You sit down, the nurse puts in the line, and we have the best nurses. They never miss. They're so good at hitting the vein. So nothing to worry about there. And once they're in, now we hang an IV bag, a very small one, and we let that drip. But we push the MUSE Cells. We don't want them sitting around at room temperature, so instead of putting them into the saline solution, we put them into the port and straight to your veins. So it's a smaller amount, that's why we're able to do it. Though, even though they're smaller amounts, the engraftment of these is much higher than mesenchymal stem cells at around 15%. So in this case, 40 million MUSE cells would be like getting 500 million mesenchymal stem cells as far as engraftment rates go. Now they do work different, so you can't compare them like apples to apples, but as far as volume and what's going to be affected, very effective. A lot of cells are going to get where needed, and in this case we're hoping to the kidneys to really help heal there. Once that's done, we're going to drip some vitamins just to make sure there's enough bricks to build the house and that we've got everything there to help out and keep a good environment. Some NAD+, some vitamin C, some CoQ10 and other vitamins drip down, feel good. It takes about 30 to 45 minutes, and then when done, can go back. And so very simple there.
The patient that David has a kidney condition. That's why we're going to do 40 million of MUSE cells. And this treatment helps a lot with this kind of condition because they travel to the tissue that has inflammation or damage, in this case the kidney. And they help a lot because they are going to travel to this area, and they are going to eat the cells like the damaged cells, and they became in this kind of cells, so they can do the work that normally these kind of cells can do. So that's why this treatment helps a lot in these kind of conditions.
After placing the IV line and once the doctor applies the MUSE cells, in some cases I continue with administering a series of additional vitamins.
So please tell me, how do you feel after your last treatment with the stem cell treatment?
The first time 2 years ago, I was basically having to use the restroom a lot because the toxins were because I have my kidney issues.
Mm-hmm.
The toxins were my body was trying to flush out, or the stem cells are trying to go in there and go after inflammation in my system. But I had a lot of toxins in my body, and so hence I was using the restroom quite a bit. But after that, I started noticing, this is like weeks after,
Mm-hmm.
I'll go to like a pool party, and I like to do breath holding when I swim underneath and try to swim the length of the pool. And that's when I noticed like my exercise tolerance had increased. Like before, maybe I'd go halfway across the pool and I'd had to stand up, because I had to breathe. But I noticed something different. And mind you, I ate a pretty sizable sandwich. And they say you shouldn't eat, and then jump in the pool because the blood is busy trying to digest the food. And I totally skipped, forgot all about that, but I continued to swim, and I realized I wasn't getting spent or, starving for oxygen.
And before that, you have some issues in your lungs, right?
Oh yeah, I had pneumonia back in 2007, going through a firefighting academy, and yeah, I've always had like issues with the volume, the amount of air that I could take in. Like, you take a full breath of air. Mine kind of fell short from that, but this time I felt like I had good lung capacity. And just recently, I was over in Los Cabos. We're on a catamaran doing snorkeling, and my friend's wife, she had these prescription goggles that they got dumped overboard. This was after the snorkeling, so we're in fairly deep water, and the staff, they were like, my friend's wife was like, "Oh, my goggles are gone," which they probably dropped down there, and the staff looked down in that water, and they're like, they weren't gonna recover it. So I put on my fins and my mask, and on one breath, I went all the way down there. I did a quick search, and I recovered her goggles. This is all on one breath. I don't know how deep it was. All I know is the water was pretty murky, and when I got to the bottom, it was a sandy bottom, and I was able to recover it and go back up. I'm thinking maybe it was over 30 feet, but it was deep. I could feel the pressure in my ears going in there, and my lungs, it was just the squeeze. Yeah, but that amazed everyone, because they were like, he's down there for quite a while. So yeah, it's testament to the stem cells, the first one, that the first treatment that I did with them. It's just amazing. And I look forward to seeing what the MUSE cells do for my kidneys and everything else. So thank you, Josh. Thank you, staff. I salute you guys, and looking forward to doing more treatments further down the road.
Thank you.
You're welcome.
DBC Diaries Day 4. Well, we want to thank David so much for coming back again, for trusting us with his health, and for sharing this with all of you. We're really excited for the MUSE cells to see what kind of results we get. David's such a great person to do this because first, we've got previous data with mesenchymal stem cells. He's seen some improvement, not all the way, and now we get to see how the MUSE cells work in comparison to that. So it's going to be really cool. Hopefully in about 3 months, we'll have new data. Might be a little further. We're giving him 3 to 6 months in that time frame to do new blood work, and as soon as we've got it, we'll post it to the site so you can take a look. Now, if you'd like to learn more about MUSE cells or mesenchymal stem cells, or participate in one of our MUSE cell trials, get a hold of us. It is at www.dbcmusecells.com, or you can go to www.dreambody.clinic. Both sites have all the info on the website. You can go there. You can also call us toll free at 888-704-3977. I'm Josh. Happy to help.